Dear listeners, this video is part 2 of the series on blood vessels and endothelium, part of Prescribon medical education series. Vascular smooth muscle cells, VSMC. Smooth muscle cells lie mainly circumferentially in the vessel media to provide contractile function, which is influenced by hormonal, endothelial, neuronal, and intrinsic influences, totally known as myogenic tone, with contraction being triggered by a wave of calcium release. VSMC contraction is the key regulator of resistance to blood flow and hence blood pressure. Relatively small changes in the contractile state of smooth muscle can produce large changes in the resistance offered by the vessel. This is particularly important for small arteries and arterioles, which are the major determinants of systemic vascular resistance, that is, blood pressure. Vascular smooth muscle cells can remarkably alter their character and functions. They may leave the quiescent contractile state and enter a replicative state, that is, as dividing cells to increase their numbers, and migrate into the intima, adopt secretory functions, resulting in intercellular matrix formation, including the development of bone-like features and calcification, and may, under certain conditions, contribute to inflammation within the vessel wall. Smooth muscle cells that replicate and secrete matrix contribute to the process of thickening of the vessel wall in vasculoproliferative syndromes, including atherosclerosis. Vasculopathy, that is, vessel changes in transplanted tissues, and the intimal thickening occurring in vascular restenosis following arterial stent. Stent means non-collapsible mechanical device to maintain the vascular canal open, and arterial stent implantation. Dear listeners, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital prescriptions, available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. Control of vascular tone. Vasoconstrictor and vasodilator mediators allow the vessel to respond to changes in the local environment, but the predominant influence of the endothelium is dilator products. The endothelium produces at least three key vasodilator mediators: nitric oxide, prostanoids, and hyperpolarizing factors. Nitric oxide, we will be dealing with it later. Prostanoids. Prostanoids are active lipid mediators that regulate inflammatory response. Prostanoids example prostaglandins, that is, mediators of inflammatory and anaphylactic reactions. Anaphylactic means severe, potentially life-threatening allergic reactions. Then the thromboxanes, that is, mediators of vasoconstriction, and the prostacyclins, that is, active in the resolution phase of inflammation, and the hyperpolarizing factors. Endothelium-derived hyperpolarizing factor is an important vasodilator, acts by opening potassium channels to allow for potassium efflux, hyperpolarization, and vascular smooth muscle relaxation. Nitric oxide, NO. The arterial circulation is vasodilated continuously and actively by endothelium-derived nitric oxide. Inhibition of the synthesis of nitric oxide leads to vasoconstriction, hypertension, and sodium retention. Shear stress, the force caused by the viscous drag of flowing blood, is an important physiological stimulus for the continuous production of nitric oxide. Shear stress increases nitric oxide production, so the blood vessel relaxes and dilates, thereby reducing the shear stress and increasing flow and reducing blood pressure. Pathophysiology. Nitric oxide appears to be the dominant vasoactive factor released from endothelial cells under basal conditions. Loss of nitric oxide leads to arterial vasoconstriction, enhances platelet and white cell adhesion. Loss of nitric oxide may enhance atherogenesis. Several clinical conditions, including atherosclerosis, hypertension, hypercholesterolemia, and diabetes, are associated with a functional loss of nitric oxide mediated effects. In the coronary vasculature, loss of nitric oxide predisposes to vasospasm and may contribute to the onset of anginal symptoms. Atherosclerotic coronary arteries constrict in response to the platelet derived mediator serotonin, that is 5-hydroxytryptamine. But healthy vessels are stimulated to produce more nitric oxide and dilate. Flow dependent dilatation is also lost in atherosclerotic coronary arteries. Endothelial dysfunction precedes the development of overt atheroma. Overproduction of nitric oxide may also contribute to disease. Bacterial endotoxin and some cytokines induce production of nitric oxide synthase enzyme in the endothelium, vascular smooth muscle, and inflammatory cells invading the vessel wall. The nitric oxide pathway has been the basis for several important therapeutic approaches. 1. Administration of glyceryl trinitrate, a nitric oxide donor, has been a long-standing therapy for coronary ischemia for inducing coronary arterial vasodilatation. 2. Inhibitors of phosphodiesterase 5, example sildenafil, vardenafil, and tadalafil, have been much more widely used for erectile dysfunction because of their effects on augmenting blood flow into the corpus cavernosum, that is the vascular network in the penis. 3. PDE5 inhibitors, that is phosphodiesterase 5 inhibitors, are also used for the treatment of pulmonary hypertension, that is hypertension in the pulmonary circulation. 4. Other commonly used drugs, such as statins, may also exert some of their beneficial effects by increasing nitric oxide bioactivity. Vasoconstrictors. Although the predominant background influence of the endothelium is dilator, important vasoconstrictor factors are also synthesized and released. Endothelin. The endothelins are a family of potent vasoconstrictor peptides. Endothelins vasoconstrict and can promote the growth of vascular smooth muscle cells. Angiotensin converting enzyme, that is ACE. Angiotensin converting enzyme ACE is located primarily on the luminal surface of the endothelium. This enzyme converts angiotensin 1 to angiotensin 2. The pulmonary vasculature provides the largest area of endothelium and is important in the regulation of circulating levels of angiotensin 2. The activity of endothelial ACE in systemic vessels may be more important in determining the final concentrations of angiotensin 2. Synthesis of renin. Furthermore, endothelial cells also have the ability to synthesize renin and its substrate. It seems, therefore, as though the enzymatic machinery for a complete renin-angiotensin system is present within the vessel wall. Prostanoids. The endothelium synthesizes thromboxane and the unstable prostaglandin endoperoxides. Overproduction of constrictor prostanoids by the endothelium has been implicated in diabetes and hypertension. Reactive oxygen species. Production of reactive oxygen species, ROS, influences blood vessel physiology by direct interactions with nitric oxide. ROS, that is reactive oxygen species, such as the superoxide anion, are synthesized within the vascular wall by multiple enzyme systems within endothelial vascular smooth muscle cells and inflammatory cells, that is macrophages and neutrophils, in addition to its important vasodilator properties. Nitric oxide acts as a free radical scavenger. As is characteristic for such agents, nitric oxide itself is also a free radical. That is, it has an unpaired electron in its outer orbit, and as such reacts readily with other free radicals. Regulation of platelet function and hemostasis. The endothelium synthesizes and releases prothrombotic, that is clotting, and antithrombotic, that is anti-clotting factors. However, healthy endothelium presents a thromboresistant, that is clot-resistant surface, indicating that the antithrombotic factors predominate under basal conditions. Platelets, that is a type of blood cells. Endothelial cells inhibit the aggregation and adhesion of platelets and disaggregate aggregating platelets. Two mediators are of particular importance: nitric oxide and prostacyclin, or PGE2. The endothelium normally inhibits platelet activation, but in response to certain stimuli, pro-aggregant, pro-adhesive mediators may be synthesized and released. Coagulation. In the quiescent state, expression of anticoagulant factors predominates, but when activated, the endothelium may promote coagulation. Fibrinolysis. The endothelial cell surface has a fibrinolytic, that is clot dissolving pathway. Urokinase and tissue plasminogen activator are secreted. Under basal conditions, fibrinolysis, that is dissolving clot formation, is dominant, but the balance may be altered by a variety of local and circulating factors, including inflammatory cytokines and the atherogenic particle lipoprotein A, which inhibits plasminogen binding and hence plasmin generation. In the presence of atherosclerosis, the fibrinolytic properties of the endothelium are diminished. Cellular adhesion. The resting endothelium prevents cells from adhering fully to the vessel wall, but allows leukocytes to roll along its surface. The regulation of rolling, adhesion, and migration is governed largely by specialized glycoproteins known as cell adhesion molecules, which are expressed in varying amounts on the endothelial cell surface and interact with complementary adhesion molecules on circulating cells. Cell growth and angiogenesis. The endothelium of healthy differentiated vessels inhibits proliferation of the underlying smooth muscle. Endothelium derived vasodilator, antiplatelet, and antithrombotic mediators, example nitric oxide and prostacyclin, tend to inhibit the growth of vascular smooth muscle cells, whereas vasoconstrictor and prothrombotic mediators, example endothelin and angiotensin, tend to promote it. Thus, the basal state of the endothelium, in which dilatation and thromboresistance predominates, also prevents the growth of smooth muscle. The heparin-like molecules prevent cell growth. Molecules like platelet-derived growth factor (PDGF) and fibroblast growth factor are endothelium-derived growth promoters. Endothelial cells are essential for the formation of new blood vessels. The ability of endothelial cells to initiate the formation of new vessels, that is angiogenesis and vasculogenesis, is retained in adults. But the only place this occurs physiologically to any great extent is in the female reproductive tract. However, angiogenesis occurs in a wide range of disease states, including atherosclerosis, rheumatoid arthritis, and tumor growth, and during wound healing or in response to ischemia. Transport and metabolism. The endothelium presents a permeability barrier for molecules in the bloodstream. Transfer of molecules from the bloodstream into the vessel wall across the endothelium can occur by transport through the endothelial cells or between them. The junctions between endothelial cells are maintained by specialized molecules, including cadherins, and are actively regulated. Transport between cells occurs when endothelial cells contract to leave intercellular gaps. This is an important mechanism for formation of localized edema. Transport through cells occurs by transcytosis and is an important mechanism for the passage of some macromolecules including insulin. The endothelium is intimately involved in lipid metabolism. Lipoprotein lipase is bound to proteoglycans on the endothelial cell surface, and receptors for low-density lipoproteins are present in varying amounts. In quiescent endothelium, lipoprotein lipase is active. There are few low-density lipoprotein receptors, indicating that healthy endothelium provides a barrier for the entry of low-density lipoproteins into the vessel wall. However, under conditions in which a low-density lipoprotein is taken into the endothelium, modification by oxidation occurs, and this step may stimulate atherogenesis. The adventitia and perivascular adipose tissue. Nerves supplying the vessel wall enter through the adventitia into the media to provide a key influence on the contraction of vascular smooth muscle cells. The sympathetic nervous system is, of course, of prime importance in determining the contractile state of the vessel. Note, the autonomic nervous system is a component of the peripheral nervous system. The autonomic nervous system regulates involuntary physiologic processes including heart rate, blood pressure, respiration, digestion, and sexual arousal. It contains three anatomically distinct divisions: sympathetic, parasympathetic, and enteric. Dear listeners, this is the end of part 2 of the series on blood vessels and endothelium. Thank you for listening to this discussion.